way the system has changed my life is that the meeting with the doctor is more efficient.
When I see the patients, we can look at the figures together and they can see for how long they've had some medication and how they are doing over time.
The core effort of the registry has been to find the agreement between all the rheumatologists in Sweden on what value we create for our patients and how to measure this value. Such data can be used for benchmarking not only on local level but also on regional and national level, and thus using the best practice examples for improving healthcare in all of Sweden. The Swedish rheumatology registers have further developed this concept and provide transparency of value and safety for patients, a real-time decision support for physicians in clinical practice, a rich data source for clinical researchers, a platform for development of life science businesses, a support for national agencies in creating a cost-effective healthcare system. The Quality Register was started in 1995 by the Rheumatologis Society. The registry all hinges on the nationwide collection of patient data, what characterized each patient, what treatment was given and how, and the resulting outcomes. The network cooperation based on the registry creates value for many stakeholders.
I think it's a nice mixture that it's not only what the doctor reports but also what the patient can report.
The kind of information I put into the register is, for example, how much pain did I have the last week because of my arthritis, and maybe it's medium. Then I go to the next. Then it asks about my daily functions. Apart from saving time, it's a way of thinking of the situation not to miss anything.
Charlotte, varsågod. It's a very good thing that the patient has registered their own assessment before they come to see me. It saves a lot of time, and they have had time to think what sort of message will they bring to me, because they know I will look at it.
One key idea in the registry is that it should be present when and where care takes place. For the physician, we provide a real-time decision support with instant feedback on the treatments of the patients and the value that is created from their everyday clinical care.
I like this a lot, as I've mentioned. I almost feel addicted to it.
One example of safety concerns with TNF blocker has been if these drugs, for example, increase the risk of lymphoma, but the data we have got from the registries show that it's the disease itself that increases the risk.
There was a special hearing at the European Medicines Agency in London. The Swedish effort in clinical research following these drugs could show that in the 9 million population of Sweden, the increase of lymphoma was hinging only on rheumatoid arthritis and not on the added treatment with TNF blockers. The register's cooperation with industry is based on regular business agreement. We deliver analysis on the data that the register own to the industries in response to their research questions. The principle is private questions and public answers.
In the future, we really need to get more data about health economy from the registries, and as health economy is becoming more and more important, and some of these drugs have a high cost.
Well, the role of the state is that we need to take care of our citizens. We don't want anything else than the best healthcare that's available and possible to give for the citizens. And the use of registries is necessary in order to obtain the best possible care for the least amount of money, of course. Bang for the buck, that's what we want to have, and the taxpayers too.
We need data to support the optimal use of these drugs in the long run.
My belief is that our example from rheumatology will comprise a key framework for outcome-based, value-guided care, for clinical research and for industrial development in the 21st century.